Boa noite a todas as pessoas aqui presentes. Vocês me escutam?
Good evening to everyone here. Can you hear me well? I'm Pedro de Paula. I am the Executive Director of the Strategy in Brazil, and I have the honor to be your host today. And the MC, how you define it. And in this super important launching that we have Mais Dados, Mais Saúde with the anxiety climate in focus. This event is part of this Urban Circuit 2025 promoted by UN with the Ministry of Cities, and we are very proud to be part of this circuit. And More Data, More Health is a program of innovation in health data collection, and it's an initiative carried out by Vital Strategies and Humane with support of the Devive Institute. This survey starts off the premise that understanding the challenges faced in depth is the first step toward strengthening more equitable and effective public policies for the entire Brazilian population. By generating more data, it's possible to support public management in making decisions that help ensure better health for everyone. We will begin our meeting with an opening panel and then a presentation of the unpublished data of the perceptions and behavior of the population of the Amazonia Legal in face of the climate change, environment, health, and pollution. After the presentation, we will watch an executive preview of the documentary Correnteza on first hand by Ana Peta and Helena Peta about the climate disaster in the Rio Grande do Sul state, and I'm anxious for this moment. We would like to begin welcoming and thanking everyone for their presence here in the auditorium of the Centro Botânico Online, and those who are following us online. We have transmission in Portuguese, in Habitat, and Vital Strategies, both in YouTube. And so to compose the opening, I now invite to the stage CEO of Vital Strategies, Dr. Meni Etiebet, the General Superintendent of Humane, Thais Junqueira, the Executive Superintendent of the Devive Institute, Renata Bizelli, and the Director of Department of Epidemiological Analysis and Surveillance of Non-Communicable Disease of the Ministry of Health, Dr. Letícia de Oliveira Cardoso. Enjoy your event. I now invite the Director of Executive Superintendent of the Devive Institute, Dr. Letícia Cardoso, for her opening speech. Good afternoon or good evening to everyone here that are present. In the first place, I'd like to thank the invitation for being here in this such important event and promoted by the Vital, and thank you very much for the invitation. This is a huge responsibility to present the government here at this round table, working in the Department of Epidemiological Analysis and Surveillance of Non-Communicable Diseases, and also understanding the climate issues. They are one of the great determinants, and they also suffer the consequence of human action, which are the determinants of the health of the population in different aspects, and also they bring also consequences and differentiated consequences for the populational groups that we have, that in the sense that they have consequences and they sort of affect the most vulnerable people. The country is in a very propitious moment, generally speaking, because we are hosting a COP, which COP 30, that will happen in a few weeks, with an important action of the Ministry of Health or the health sector as a whole, taking proposals, effective proposals of the acknowledgement of the interaction between the climate and health, and not only with respect to what we already know issues from quite a while ago of communicable diseases like dengue and arbovirosis, but also for other fields that we acknowledge as being important to establish this relationship and take care of this relationship within our healthcare system. So the topic about the climate anxiety and the impacts that we know that climate tragedies affect the mental health to the population, and they are very acute, and we have to be prepared to embrace and also to take care of the people and avoid these situations. And also issues with respect to the ones related to the planting of tobacco. We have a COP of tobacco which will happen ahead. We have very concrete proposals in the area of the environment, like microplastic transitions of plantation. Brazil is one of the largest, actually is the largest producers. Brazil is one of the largest exporter of tobacco to the world, and it is indeed, as I mentioned, we have several fronts here of action. So we are at very propitious moment, not only with respect to the healthcare, but in different areas of the government, understanding that the energy transition is a very important step so that we can take care of our country and our planet. I thank you very much for the opportunity, and I hope to get to know the data which are important, the ones that will be presented here today, and also discuss this with you. Thank you very much. Thank you very much, Leticia. I believe that those who thank us for the partnership, and I pass the floor to the Executive Superintendent of the Revive Institute, Renata Piselli. Good afternoon. It is a pleasure to be here with you. Another launching of another action here. We prevent chronic diseases, and we have a lot of care for projects that take this to the SUS and that serves the Brazilian population. I'm very anxious to see the results. Today we had a very good conversation at Vital, and it is interesting how this initiative, like More Data, More Health, then speeds up these actions, how we could bring agility to these processes. So this is the third, if I'm not mistaken, third round, and also it's very impressive to see how we can gather information very fast that are very important for the public policies that are to come. So now the question is, what will we do with these data? I hope you enjoy the results. Thank you very much. Thank you very much, Renata. It is a pleasure to be with you here and to advance with respect to the understanding of the data to improve the conditions we have in the country. I pass the floor now to the General Superintendent of Humani and Thais Junqueira. Good afternoon to everyone. Thank you very much for your presence. I compliment the Ministry of Health on behalf of Leticia and also for this initiative. And Marianne, is it the first time in Brazil?
E cumprimento nossa parceira Renata Biselli.
And also I compliment our partner Renata Biselli has supported us since the beginning. The idea of conducting this work between Humane and Vital is to find a way how we can contribute to the very important and well-established national surveys, in a way that we could respond in a very speedy and dynamic way, topics and emerging or hot topics with respect to the public health that have to be tested or generating one or other result in terms of methodology, collection, the time of the processing of these results. And this is what the civil society and philanthropy can do very well. They can organize themselves and get interesting partners, and so that they can generate material to feed the future surveys and also the ones to be incorporated in other aspects, but can also do innovation with respect to healthcare public policies. The idea, this is a third edition within Mais, Dados, Mais, Saúde, is that we were a partner before in 2 editions of Convitel. We had an interesting, very good learning of this process, and all this work here that is in the web, which is in its 3rd edition, basically it follows the same rationale to work in an agile and dynamic topics with respect to healthcare aspects. Everybody knows that today climate changes has impacted all the lives of all the aspects of our life. In health is even more, actually in all the life cycle, even before we are born, this impact already happens. And this part with respect to Amazonia Legal brought other challenges. And what is very important as well that we'll have the opportunity to hear here today is how did we get to a population that lives in very remote areas of our countries. This was a new learning within this partnership. And another thing that was very important so that we could see and analyze and understand is the difference that exists with respect to the results and the impact among the traditional and non-traditional population. So this regional analysis allowed also a look on this. It brings data that are new, and we build with other organizations, the public and power, and all of us that we have come together to support this initiative. We can use it in different ways, but it can be also unfolded, and there are many things to be understood as well. So we are facing a huge challenge, and we hope that today's work will contribute to everyone, and also may we communicate it or convey it to the best way possible for the Brazilian society. Thank you very much. Now, thank you, Thais. It is a pleasure to continue in this undertaking where we can test and advance in the generation with respect to healthcare in Brazil. Now, I pass the floor, and I'd like to invite Dr. Mary Ann, CEO of Vital Strategies.
So many people here today. I am my day 2 in Sao Paulo, visiting our Vital Strategies office in Brazil. And I have just been blown away, not only by the strengths of the partnerships, that we have here, but by their impact. And their impact that's driven through innovation, and innovation on so many levels, including how we're collecting public health information. And I'm just really excited for you to hear the results. I won't give any away, but what I will say is that some surprised me. And I realized I had to check myself. I had made certain assumptions, and I probably had some unconscious bias. And the results checked me, and I think that's why it's so important to do this and not to assume that we know what's happening or that we can talk, for the communities that we aim to serve. I wanted to share another reflection. There's a saying, I'm not sure what the origin is, but there's a saying, a rising tide lifts all boats. And, it speaks to when you improve a system, you improve it for everybody. Everybody gets better. But that's assuming everybody has a boat. How many people don't have a boat, have a raft, have, the floaties, have a canoe with a hole and are, working hard to get the water out of the canoe. And what that tells me is that we need to understand that whatever it is we do, even with the best intention, has differential impact on different communities, depending on where they're coming from, where they're starting, and what they're experiencing. And that's, again, why it's so important for surveys like this to come to light, to bring to light the specific experiences that are happening. And I think, as importantly, the understandings of the issue. Because unless we integrate those understandings and those experiences and how we think about the solutions, they will never serve adequately the populations that they are meant to serve. And one of the things that we aim to do and strive to do at Vital Strategies is how do we partner with government to build strong, effective, and equitable public health systems, that can protect everyone everywhere. And we can't do that unless we actually understand how these systems are currently affecting people and what they want from them. So I'm so excited about this. People have already heard that, I am wanting to evangelize this work across all of our different partners across the globe. I think that this information is coming at a very critical time where decisions are being made. You mentioned COP30, but also all across the world where a lot of governments are redesigning their health systems and thinking about how they, how they do this work more effectively, more efficiently, and using innovation. So I'm excited for this. I'll stop talking and just thank all of you for coming and thank you for your partnership. In particular, I want to thank you, Maine, and Vive, am I getting it right? And our government partners, and I'm hoping that we can continue to work together and making sure that whatever it is we're doing around public health, we're making sure that we're putting the public and bringing the public, into what we're doing. So thank you.
Muito obrigado, Marianne.
Thank you very much, Mary Ann. Now I invite everyone here to take their places on the audience. But firstly, would like you all to take a picture. So we have a photographer here that will guide us where we must go to take a picture. Okay, we'll be standing in front of the stage. Thank you very much. Thank you very much. Now, following our schedule, now I invite the Dr. Luciana Vasconcelos and I invite the State Deputy Director of Chronic and Communicable Diseases, Advisor Strategy, Dr. Luciana Vasconcelos Sardinha, and Technical Specialist Gabriel Cortes to present the unpublished data from the third module of Mais, Dados, Mais, Saúde. Good evening to everyone. It is with huge pleasure that I'm here with you, delivering this important delivery to Brazil. We are focusing on the population that is so invisible of the Amazonia Legal. This survey was thought within this context of this year of COP30, and we are wanting to shed light in this relationship that is very intrinsic between the public health and the climate changes. So I will now begin presenting a bit of what Pedro has already brought, and I think I can see it from here, that Pedro has already brought the pillars of this innovation program that we can supply information to conduct and induce public policies and effective action. Now, as of now on, as mentioned previously, we already had 3 editions this year. So the first one, we worked about the quality and the access of primary health care. It was a survey that clarified a lot the point of view of the user. We already launched this in April. In May, we also had a survey based and also a questionnaire where we could see the everyday aspect of the discrimination, and we saw that the racial discrimination was the most important one. So on a daily basis, this happens to people, especially with respect to women, black women, and also we observe that there is even more discrimination among these populations, and we could show with information that we also say that black women, they have more difficulty on their day-to-day lives, and we could show this. And now this data, Mais Dados, Mais Saúde, more data, more health, climate, and health in Amazonia Legal. So we must think that climate change, they are not an aspect of future. We're already seeing this. This is happening, and people are being affected. So these transformations depend not only with respect to the feeling of threat, but the behavior to mitigate these problems. To understand these dimensions can indeed bring an alignment that is necessary so that we can act with respect to this. We conducted a survey in Amazonia Legal. It considers the 7 states of the North region plus Mato Grosso and part of the Maranhão, part of the municipalities that are part of the region of Amazonia Legal. And we used a questionnaire that was validated internationally wise, where you could have a scale of climate anxiety, where you could see several points of view with respect to the climate anxiety aspect. And we studied the personal experience of these people that were interviewed with respect to the climate change and what was their engagement. If, in fact, this also causes an anxiety that transforms this in action and in attitude. The collection of data was done 100% online through web, and people, when they looked at the platform, they received a link and an invitation to participate. So it explains the goal of the research, and if the person shows interest, it clicks and receives a link to answer. So there are also this part of privacy. The link could not be passed on to anybody else. So this was very well worked in methodology, so we didn't have a problem of representativeness among other aspects. After this, we received the data bank. It was a sample of around 4,000 interviews. We looked with respect to the last census in Brazil, and we observed that if the distribution for sex, age, schooling, income, among other aspects, were accordingly. If we didn't, the sample wasn't biased, with a with a methodology used since 2006 by the Ministry of Health. We then the results that I will present here are really represent these 9 states that represent the Amazonia Legal. The profile of the sample, we notice that it is an interesting behavior. Since it is a methodological innovation, we want to show that it really is reaching where it needs. We will see the profile of the sample, which is 50% for each wave of sex, age group. In Amazon, it's younger. Amazon is younger than other regions in Brazil. With respect to income, we have a concentration and lower income. With respect to race and color, there is a discussion. And here we have a partner who has worked with us, which is Janaína Kaluki, which has worked with the survey in all our projects. and she participated in the survey that was launched. And there's a great discussion with respect to this data of Amazônia Legal of being a brown color. Since it's self-referred, these traditional populations, they do not have a very specific identity, so they end up putting in this place, they are put in this place. So these are the questions that I received previously, because why aren't we going to do an assessment? But it is there in the report for those who want to look at it in detail, this aspect with respect to race and color. Over here, we will look based on each state. We observe that it follows the population of the state, the density of each one of these states, and also we asked about traditional peoples, if the person self-identified themselves as quilombola, extractivist, Ribeirinho, indigenous, among others. And in summing this all up, we showed it was about 45% of the population. 44.2% named themselves as part of a traditional population. And we observed that in Amazônia Legal, we have an important part of almost 80% and being dependent. Now, with respect to climate anxiety, the first module that I mentioned, which is one of the possibility of seeing climate anxiety according to the experience, the personal experience with these climate changes. A third of the population directly being affected. They report being directly being affected by climate change. Around 40% know someone that was in a way or the other impacted by climate change. And 31% notices climate change in a place that is important, be it in where they live or where a family member lives or spent a part of their lives there. So if we look to these three indicators here, and we can observe for the people and traditional communities, the column in blue, we can observe that traditional communities, in all the indicators, they present more prevalence. Now, with respect to climate anxiety, with respect to the engagement point of view, I feel there is a problem. We are living the global warming, a lot of drought or floods or whatever it is. But what is the behavior of such population face of this? We noted that at least half of the population refers that based on what is being presented, they could have behaved in a more sustainable manner. So here we introduce a definition with respect to sustainability, and this shows strongly where half of the population refers to this. Now, 36% state that they've already started the recycling. This also is an alert because it can be reused. Maybe the focal group that we did before implementing the questionnaire, generally speaking, but it can be a double interpretation, recycling and reuse. For example, many of the traditional population, they reuse the materials like a PET bottle. It can be worth gold for other circumstances. So we have these 2 points mentioned. Half of the population then of Amazônia Legal reduced in a way or the other some of the behavior that they judged being harmful in this situation of climate change. 38% feel guilty with respect to the waste of energy, and also we know that in this region of Amazônia Legal there is a more sensitivity with respect to energy, potable water, and safe food. They already notice this aspect of the waste of energy. 46.8% believe that they can do something to solve or mitigate this problem that they are facing. Once again, I draw your attention to the traditional peoples and communities where in all the indicators, the only difference where you switch off the lights, they are more for traditional populations. So it is a population that is already observing this change. This was not something that like they didn't have this meeting last week. This didn't happen, but they have been observing this in the last decades and noticing that the problems are becoming more and more frequent. They think, oh, I'm behaving differently. I switch off the lights. I try to reduce my behavior that contribute to climate change. And once again, all the indicators are being higher and prevalence for this population. Now, we also ask that beyond this validated scale about the environment, and this shows that the reality at 64%, it's not a small figure. That shows that they usually separate the waste for recycling slash reuse, as I mentioned. So it's not throwing the things away and separating. They have this reuse, the utilization that goes beyond recycling. So 63% already stopped buying or using product that harms the environment based on their own judgment. Self-judgment. 88.4% believe that climate change, they're already happening in Brazil and in the world in the last 2 years. And here we put a limit of years, 2 years. So it's not something of the long term. We are saying that these people are already feeling this, and 3/4 of the population are going through this situation and feel the change. 90% is already living the global warming, and this data is very coherent with the previous data. And once again, we are showing this traditional people and traditional community. We notice that they acknowledge and they have more attitudes for these traditional populations. So climate event in the last 2 years, we asked them, when many acknowledge this, 64% talk about heat waves, and also we will see in the documentary that was presented, we have extreme in the Rio Grande do Sul region, we had floods, and here in Amazonia Legal, we have droughts. So this is counterintuitive, but they are living this, so they can indeed refer to this in a coherent manner. 30% has already experienced persistent drought, more heat and less rainfall. 30% environmental deforestation. They have lived this in their territories, experienced this in their territory. Almost 27% shown worsening of the quality of the air. We're talking about forest fires that affect the water as well. We have an indicator for this, that the quality of the air is also being harmed, where we have more droughts and other aspects that can affect also the food safety in a more broad manner, as of food, potable water, or drinking water. And here we see that 20% has already observed the worsening of the quality of water. 20% has reported changes with respect to the patterns of rain and observed flood. 17% has already seen some differences and impact in the production of food. 11.5%. The weather is colder than usual. We have cold climate in Amazonia, but the vulnerable population feel this much more because sometimes they do not have the support of a coat, of a blanket, for example. It was very interesting to observe this. There was an increase in the heat, but we also observed that 10% of the population talking about the aspect of the cold weather. For traditional populations, we observed a light increase of the prevalence for this, but here you can observe that it's not so different. What is this saying to us? That in fact the Amazonia Legal, be it the traditional peoples or the rest of the population, are already experiencing these aspects. The influence of the warming of this in this specific region, 83%, they talk about the increase of the energy bill. There are other factors, but the climate change also is interfering in this. 82% have talked about the average median temperature current with the previous data. 75% of the increase of the pollution, air pollution, because of the forest fires and long drought period. 74% has already identified the occurrence of environmental disasters. 73% the increase in the price of food. And it's important to say that for the traditional populations that cultivate the land, they are close to their food, and we are inducing and understanding that what would be more the traditional population, they have an increase of the price in the large urban center, the lack and scarcity of what they're already planting because of the drought, among other problems. 62% has shown a reduction in rain that impact the plantations, 47%, the increase in rain. And once again, you can observe that in all the cities all the data that I've been mentioning, we also involve the people and communities are more prevalent. And now I'm going to call Gabriel to conduct this discussion, but saying that public policies, they need to take care of this and be accountable for this, because it's not the future, because it's not a medium and long-term plan. It's for today. It's current. We can do this. We can only do this with integration. Resources are always scarce, be it human, financial, of all sorts. So if we put everybody on the table and face this problem, we will at least be able to mitigate this problem and give more quality of life for the population. So information is good for this, for action. It's not just to look and observe how many problems we're facing, but we are here today to also take this to the public authority and partners in the third sector and the academia, so that we can induce efficient and coherent public policies. Thank you very much for your attention. Good evening to everyone. I am Gabriel. It's a pleasure to be here. Thank you very much, Luciana. And I'm going to bring a little bit of some of the reflections that we looked at inside this report and what we can bring about what it brings to us to think in relation to the actions that we must take today, tomorrow, and afterwards. Now, important aspect here is that we have to battle negativism. It is a research that brought a methodology, scientific methodology, and the perception of people about the climate change. We know that until today, there is still governors or authorities, public authorities, they deny this climate change. This report shows clearly that climate change and their impacts are being lived by the people on a daily basis. So this is very important so that we can also make public policies, as we've just mentioned. An important aspect with respect to this research is the technological and methodological innovation, because when we're talking about a survey in the Amazon or thinking about Amazônia Legal, this data collection was done in 59 days. We know that in Amazônia Legal, distance is not measured in kilometers. It's measured in hours and days of traveling. So imagine you conduct a research with a huge representativeness in the Amazônia Legal that got to places where other methods would take too long. This has an operational cost, indeed, which is very huge. So this methodological innovation shows that this study that is very specific can be replicated to other surveys and other aspects that are important to be researched. Now, besides this innovation, I believe that the project and the strategy, thinking about the program More Data, More Health, is that we got to talk about innovation. How is this information research and that do this kind of research should be done as it was, and it should be done by the government. And we have to point this out and reinforce the role of the civil society and the potential that these partnerships can have so that we can produce public policies. And we notice that great part of it, be it 90% of the traditional, non-traditional population, that climate change is affecting all these spaces. Now, these spaces here, we usually say, well, we are living climate change, so the focus is on the Amazon region, and there is a need to assure the standing forest. So you focus on the forest, focus on the forest. It's important to focus on the forest. And we know that the standing forest, and who maintains the standing forest? What are the most preserved areas? These are the areas that are occupied by whom? By traditional population. So communities and populations, traditional communities and populations. So we have to look beyond the biological aspect and nature, and we have to look to the people that are there. And this report brings this. And when we think about the Amazon, well, we think, well, the Amazon, that huge forest, but we think that, in fact, we have an urbanization process, and the cities among the Amazon, people are all the environment, including the urban environment, and the impact of climate change has been observed in all the spaces and in the cities as well. These are cities that grew in a very high speed and in an unorganized manner. So this way of how these cities are organized in themselves put the people, and the people feel the impact of the climate change and the impacts with respect to the way of living. So when we're talking about the Amazon, so this is a service. It's not for those who live in Amazônia Legal, but those people that are there are feeling this, but it has a repercussion in Brazil and as a whole, and also in the world. It's important to point out that the climate crisis is not only an environmental agenda. We have to talk about the health and have to assure the rights of everyone living there. So to bring the focus to thinking about the public policies, there is no focus currently for the traditional populations. And this research did this, exactly focus on these populations, showing their reality and showing that they are facing a vulnerable situation with respect to the impact of climate changes, and these are the ones that have a higher potential of change, and to guarantee the standing forests. We need specific policies to look to these populations and to strengthen the protagonism of the population and of the traditional communities when we make public policies and strategies. So we need to know more about the data that was done, and I'd like to thank the team that helped to prepare this report, those who answered the questionnaire as well. And also, here, if you point your camera here, you have access to the report, the full report with all the details, with much more results that we brought. We just did a brief summary, and I'd like to thank you very much for your attention. Thank you very much, Luciana, Gabriel. I'd like to invite to the stage the participant of our reflection and discussion panel, Dr. Lícia Cardoso, Director of Department of Epidemiological Analysis and Surveillance of Non-Communicable Diseases of the Ministry of Health, Wanda Witoto, Executive Director of Witoto Institute, Renata Reis, Executive Director of Doctors Without Borders Brazil, and also our counselor, and also Dr. Érica Pellegrino, psychiatrist, professor at the Federal University of the State of Pará. The mediation will be carried out by Daniel Nardini, CEO of Amazônia Vox. Thank you very much. Good evening to everyone. Thank you very much for all of you that come. I'm a journalist, so I'm going to draw away a bit of the protocol because at this time everybody is here listening to us. Beatriz, please tell me when I reach my limit in terms of time. Just to introduce the topic, there are 4 women here that I'm the only man here. I'll just pass the microphone and they'll talk. But just to contextualize briefly this, I'm a journalist. I'm from the city of Belém. I founded Amazonia Vox, and I'm very proud and happy to see people that are from the Amazon that are in the space that we are looking to. Our concern is that post-copy, people will notice that there will still be life in the Amazon. There's been a lot of focus to the Amazon, but we are very worried if this will continue afterwards. This is an important moment for us, and so that we can have this space, and may it continue. And data like these start showing how much people live and how they live. And also, I have studied the climate aspect a lot, and Amazonia Vox is also one to focus on the narrative produced in the region. It's not the fact of creating or innovating, but people have been working for decades and talking about this, and now they have the opportunity to be heard. And also, this is a moment where we start to translate much better a few things. And when you think about the Amazon, if you could do a mental exercise, the word Amazon is already in your mind, the color green. So the Professor Tarcílio Amaral has a book called Marketing of the Forest. Tarcílio Amaral, the professor of the University of Pará. When you think about the forest and rivers, when you hear the word Amazon, and then you ask what more? Deforestation and etc. So we have all these problems, but we have to show that the solutions of the Amazon are in the Amazon, made by those who are there, and that people need and deserve support so that they can produce and not initiatives coming from outside. So I start then asking to Wanda, just a second, I'm going to read this mini profile here, and I will then ask the question with one, and then goes back, you present it rapidly, the other one. So Wanda Vitoto, I'm going to summarize it, okay? Her bio is quite big. She's from the state of the M. She is a graduated nurse. She works strongly with the communities, both in the territory and in Manaus as well. She's going to talk a little bit about this. But looking to this, I already asked you, it reminded me the concept of climate justice, where we talk a lot about, but I'd like you to talk about this, how much these figures help you or help us to understand how the traditional population are more vulnerable and exposed to this, because this is important. So we've got to leave the concept and bring it to real life. We're all exposed, but not all of us are vulnerable. And I'd like you to mention something about this. Thank you very much. I compliment everyone in the language of my people. I come from Manaus, but I'm from the border. I am from the Alto Rio Solimões, which is a river, the Amazon River. And to bring a bit of this reality, I'd like to bring a context in this place where is peripheral. And I liked the figures that were presented in the report, considering this aspect of the indigenous population. When we talk about health, for this population, health will not be described in these concepts that SUS presents, that the World
quando a gente pensa a saúde para essa população,
Organization presents. When you think about the health, it's got to do with the well-living of our populations in the territory. So the indigenous population, if it will consider this well-being of this health, they will consider based on several elements like the safety of the territory, access to water without mercury, the fish in the territory, plantations being made. And when we look to the scenario of climate change, and above all, the term of the concept of anxiety, climate anxiety, this term, when we look to the reality of the indigenous population, we live a historic anxiety, colonial historic anxiety for many, many years. When we look to this way of life that is imposed over this population, that puts our territory, our culture, our spirituality in a space of great vulnerability, there is a data with respect to the health of the indigenous population. We have the highest rate of suicide among the indigenous population, and the place that I come from, for example, the river Solimões, Amazon, and Rio Negro, these are the regions of the highest percentage of suicide. So you can measure and see the impact, the historic impact that was imposed on this population, and worsened during the pandemic, and also became worse with this climate aspect. I am in the periphery today. I live in the Park of the Tribes, or Parque das Tribos, we've been trying to create several mechanisms to face all this, because the state does not acknowledge our presence as indigenous subject in this peripheral region. In the last IBGE census showed that 60% of the indigenous population are out of their territory because of several processes of violence and also being sent away from their communities. And then we asked, how is the mental health of these populations, these indigenous populations? Recently, we had a data bringing a bit of this, and Fiocruz was one of the organizations that was very important during the pandemic that conducted epidemiological study of these indigenous populations, showing that this data, a more concrete data, making SUS to look to this population and try to create a mechanism of facing this in our territory, which is not assisted by public policies within the peripheral context. This data, when we talk about the importance of data to think about public policies, for example, Fiocruz during the pandemic did an epidemiological study bringing indicators of the health of the indigenous population in this peripheral region, and culminated in the data showing the need for the construction of a UBS by the municipality. We wrote a letter during the pandemic that consolidated with the study of Fiocruz, and that today we have a UBS of level 4 serving the indigenous population in the periphery of Manaus. These data are very relevant when we consider the indigenous population. This data with respect to the Pardo population. In fact, the Amazon is considered a Parda Amazon, and with respect to the racial aspect, this Pardo is reivindicated by the black population. And this was a state policy of trying to erase this indigenous existence. The Amazon then was made brown, so to say, or pardalizada. So we are brown, so the indigenous population in the Amazon, they are not Parda. So these data are very relevant in this aspect, but also but this population continues to be invisible when we see 1.9% as identification as indigenous. But these data are important, but when there is this dimension, it continues deleting this population, so to say, because the Pardo population in the Amazon was an instrument of the
negar a
IBGE to try to deny the existence of this population. So we have to pay attention to this. And SUS today, in the Amazon, we have doing this work with other organizations so that when they are seen or served at SUS, this mapping is done by SUS so that they can serve the indigenous population. We then search the SUS system because there is no identification process, and without this data we cannot reivindicate public and differentiated public policies, because when SUS, for example, when they speak their own language and using their medicine, it's not being acknowledged. But I will close now, but to say that these data are extremely relevant, and I'm very pleased that this research was done in the Amazon, considering the 9 states. The northern region has the largest index of indigenous population. The state of the Amazon has almost 500,000 indigenous population. So these indicators are very important for this population to create public policies and face climate changes. As you mentioned, the mental health, I will now change the order that we arranged previously. Erika Pellegrini, who is a psychiatrist of the University of the State of Pará in Altamira, coordinator of SAM Health in Harmony, March in Sustainability, and integrated research group Saúde of the University of São Paulo. Now, Erika, talking about mental health, you are from territory. We talk a lot about the Amazon, but I was recently in Brasil Novo, and when the municipality is called Brasil Novo, and the other one is Medicilândia, we try to, you have an idea how this municipality was created in the region of Altamira. And I noted that the municipality of Brasil Novo, they were putting also the symbol of the municipality was a bull. Now the symbol, they've changed it and they put a cocoa bean. So you work in this region, of course, which is quite conflictuous for a number of decades, and it feels a lot the effect of the smoke, of everything you feel there. But I'd like you to tell us if you have noticed the increase of cases of mental health because of climate anxiety, and if you have already perceived this. And also, I'd like to talk about the healthcare or the health of the indigenous population, because there are many indigenous students that want to go to university and then go back to their territories. Thank you for your question. I'm thinking, and also luckily, Wanda gave us an amazing overview. So based on what she mentioned, I've been in Altamira for 8 years. I went there. The first time I went there is to hear the psychic suffering caused by the implementation of the hydroelectric power plant of Belo Monte. There is a case of, this case is quite pragmatic with respect to violence and so on. The way we put it in words is that these populations are being made vulnerable because it's not something that comes from this, but it is imposed on them as a state policy. Belo Monte is a state policy. So, and how challenging this is for the survey, how we isolate these things to think about casualties and what is indeed causing this increase of vulnerability, suffering, anxiety, and mental health. I believe that, and I like to bring this experience from the past. So the first time I went there, when I moved there to work in the university there, to work in an organization that thinks about hearing and implementing solutions that comes from the territories of the communities, we then go face this of what Wanda said. It's got to do with the good way of living, to think the health and mental health not as something isolated or something that we bring and in a certain way we force or diagnostic medical model, which is which is not adequate. So if we consider the DSMs of life that think about diagnosis, psychiatric diagnosis, we see the pathologization, so to say, of life. So this idea of climate anxiety evidences this, because what is the use of a diagnosis or the increase of cases of pathologies or mental health? What is this for? Is it good for us to treat? And within psychiatry and mental health, this works just to put the fault on the individual. You are the one that has depression and has the anxiety. So we don't look to the problem as a whole. When we say that there is an increase of suicide in indigenous population suffering with respect to climate changes, we are showing something much bigger that's got to do with I'm going to talk about indigenous population from the region of Altamira, Cachoeira Seca. This is the area. Once we're talking about hearing about mental health, what is psychiatry and what is a psychologist? We discussed this with the group that was there. Once, one of the leadership said, I understood what you said. You're talking about the fact of us suffering, and we are indeed suffering. We are suffering because our territory is being invaded. And I hear the material, I hear them cutting down trees, and then I don't go out at night in the Amazon. So we're talking about something much broader. So data has to be looked within this context of thinking how we implement public policies within the traditional population way of life and their good way of living, so that we cannot generate more mental health issues, because those who are anxious with climate changes, great part of the population has been undergoing this for quite a long time. This is not a diagnosis. This has got to do with mental sanity. So this, what was created, was thought within the context of the white North American individual. But in this case, which is different, because indigenous population have a colonial anxiety. Renata, now, who is a specialist in health care, over 15 years in advocacy, strategic investigator, and currently General Director of Doctors Without Borders in Brazil. Now, Erika, I'd like to actually ask this question, also referring to what was said. But we mentioned that the ideal world would be that the Doctors Without Borders shouldn't exist. So you arrived at the places where the problem has already been occurred. So we see this disaster. What reports have you noticed, or insights or ideas, to prevent, considering this layer here, where anxiety is a general problem? And now we have the anxiety with more anxiety, because we add to this is the climate changes. So the European teenager looked at the news on TV. They said, "What's going to be of my future?" And the indigenous teenager thinks, "How am I going to get to school because I cannot cross the river?" So, okay. Good evening to everyone. I'd like to compliment my colleagues here. I'm happy to see Wanda here. We met during Parque das Tribos during the COVID. So Doctors Without Borders, we were there working. I'd like to compliment Vital That is an organization that lives in my heart, and I have an honor to be counselor of Vital as well, besides being Doctor Without Borders. So what he asked me was, bring us in practice what you see with respect to the data. I'm going to talk about what Doctors Without Borders, our teams have seen and reported to us, that do not only talk about Brazil, but I'm going to concentrate a bit on Brazil just to talk about this. Doctors Without Borders came to work in Brazil with malaria and cholera in the past. So now we are back working with the Yanomami population. We are closing this project after 2 years with malaria, which obviously has been made worse because of the gold mine. We could never imagine our existence of 50 years in Brazil and 30 years in Brazil and 50 years of this organization. What happened is that the most affected population were the populations that were vulnerable. They are not vulnerable population. I agree very much what Erica mentioned. I'm going to tell a case about COVID, and then I'm going to talk about mental health. During that crisis, we worked with 30 projects in 12 states during a year and a half. The Terena population was in a very critical population in the state of Mato Grosso with respect to COVID. And we started working with this population. We did not have authorization to work with this population by the Brazilian government. We went home and then said we have to denounce this because we cannot just see what we saw and not being allowed to work with this population. So what happened is that the Terena population organized themselves and they denounced the fact that the Doctors Without Borders couldn't work in this area. The Terena population did the speaking out. So this shows the power and the strength of these peoples. So it's not just by chance that they survived. It's about fight, organized fighting. So all the healthcare organizations have a lot to learn with these populations. It is evident that these populations are in the eye of the hurricane because they are the ones that suffer the greatest impact. And the first answer will eventually come from them. So we have to reinforce the community in their capacity because they will be the first to answer. Then we went to the Rio Grande do Sul, the way it was in 2023 in the first flooding, and we returned in 2024. What was our work there the first moment? What did we need? Brazil responds during a crisis. We have an efficient SUS system. It's powerful. It has problems, but it is a country that has a robust system with a capacity. And where is the healthcare gap? How do you reconstruct an area completely devastated by a serious environmental situation that happened in the state of Rio Grande do Sul, thinking also that the mental health of these populations is also devastated. I have a psychologist colleague that was with us at that time, and also we arrived to do the emergency mental health in a huge crisis like that, and not only by the people that were affected, but for the healthcare professionals that are also victims. They do not have their house, their families are in this difficult situation and are in the front line. We also offer healthcare aid for these colleagues. You start constructing resilience, and you think about the physical reconstruction of these people lost. And the following year, it happens again. So Doctors Without Borders has been working during the last 50 years with this environmental disasters. The first one was during an earthquake in Nicaragua. So we always worked with great crises. But the fact is that things are becoming completely out of control. There is a clear evidence, because denying this is the lack of evidence. But evidence is very evident. So we cannot restore and recover what you lost, including the panic of seeing when it's beginning to rain. So how do you build resilience in that population? So this is what happened in Rio Grande do Sul. Another crisis arrived. So the topic of health is completely connected to the climate. I'm very pleased and happy to see these data, because I believe Brazil, and I'm also going to, I'm going to talk about more specifically about Brazil. Brazil has this interesting component also that surveys with respect, the surveys are done with race and color. This is not the tradition of the humanitarian world. This is what we provoke inside our organization, how important and relevant this is. And just to conclude, I think we have a little time. Many people are going to also deliver their speech. But the data shows the fact of the Pardo data. So this data is very, very interesting to be explored. So this speaks a lot about how the data respond and how they help us. So how, if you do not use data the best way possible, the data is political. So I'd like to thank you for this, because just by your comment, this roundtable was really made worth. Thank you very much. Now, Letícia Cardoso, Director of Department of Epidemiology and Non-Communicable Disease, the Ministry of Health. We have here Alexandre Padilha. He was in Santarém as well. So we have a minister here, and the data has shown clearly that, how much a region needs to be cared for, and impact with respect to public policies. Now, I ask you with two aspects here. Have you noticed the increase of mental health issues? Because we know we have the SUS, but very few municipalities have. We followed what was done, prenatal coverage, and the mayor mentioned that we include the aspect of mental health, because they saw this and they noticed this in the population that lived by the rivers. And did you notice that this is more intense? And is there a public policy that is being thought about for that region? It's very good to see data. And before answering your question, I'd like to point out the fact of what was presented and connecting this to what my colleagues already mentioned, and regarding the innovation of the methodology, which is very interesting, because as Luciana mentioned, we have a healthcare system for chronic diseases, but not only for chronic diseases, it also assesses many of the public health intervention, implementation of a new law, like for example, the law, for example, for public policies. And for the first time, we measured the use of online game and the impact on the mental health and other aspects. So for the first time, we measured this. We will release new data. And this is a very robust system that brings many answers, and it assesses emerging issues, but it has to innovate. So it's important for you to bring this component of technological innovation to maintain the sustainability of the information. I learned with my new boss, the Secretary Marianja, which was Vice Director of OMS, during COVID, who is now in the Secretariat of Health and Environment. We can only measure what we can only value what we measure. So it's very important to tell you that the Secretary of Vigilance and Health will conduct this year the first national research for mental health in Brazil with an going in depth with respect to the details of mental health. We are conducting a pilot project here in October. We begin in 6 Brazilian cities and we'll be going out to the field in November. This, we have to value mental health in terms of giving more visibility for the whole of Brazil, differentiating indigenous and non-indigenous population, so that we can have this information in more detail. Currently, we have markers that tangibilize the problem. So it's not the fact that we did not measurement about this. We have certain indicators at Vigitel, but even in the school environment, for example, according to what Wanda mentioned, suicide among young population. We have just left Yellow September, just finished Yellow September, and I could share with all the secretaries of the Ministry of Health saying that there have been advances in implementation of mental health care measurements in the indigenous population, bringing new tools that was built with the community. Because as my colleague said, you don't get anywhere, especially with respect to indigenous population. Or if you think about the Ottawa letter, we're talking about empowering of the population. So we have to build public policy with a social participation. And with indigenous population, this is even more important because they have their own values and their way of living. So it's no use a closed package with ready measures. So I had the opportunity following the launching of new interventions that were built in 16 places, the expansion of the teleconsultation. This is very important for Amazônia Legal. It's got to do with mental health as well. We need innovation, technological innovation to deal with this territory because sometimes we cannot reach certain places, many places. The expansion of the internet network in Amazônia Legal is being, in fact, implemented, and these appointments or doctor appointments online. And I'd like to mention about the data with respect to the indigenous population. When you look to the main information system of the Ministry of Health, we have indigenous, but we do not have ethnicity, we do not have the detail. This only exists in another system called SIASI, which is a system specific for the indigenous population. And because of the Yanomami populations, we sort of compared the system of mortality in Brazil and SIASI to see if there was a huge or a small gap, or what gap there was with respect to the population that were in their locations. If we look to the thing, we can see that it is almost very much aligned. But we have to do is to give more visibility to this because it exists, but it does not have so much visibility as it should for public policy. And lastly, I think it is essential, and I'd like to agree to say that with the role of the third sector in the mobilization for public sector, because more data, more health, more information, more empowerment, more public opinion, more pressure on top of the decision makers, so that we can prioritize the policies that are most necessary. So thank you very much for this opportunity to be here, to be listening to you and learning, and being able to reflect over the advances that we still have to do.
fazer o inverso aqui.
I will then
Começar a rodada final
begin
contigo,
with
e
a
vem de lá
final
pra cá.
round
Pode
with
ser que
you,
daí,
then
então,
I'll
já
go
fica com o
from here to
microfone
there. So just
Mas aí
keep
de
your
perguntar
microphone. So
basicamente,
I'm going to ask
citou, e
you,
assim, o Brasil
you
tá liderando a
mentioned
iniciativa
and you
global
said
pra
that
integridade de população.
Brazilian
E
is
a gente tem duas crises
leading
simultâneas, né? A crise
the
climática e uma crise de
integration
desinformação.
of information.
Enquanto
But
que a
we have two
desinformação que
things
vocês
here,
viveram,
the
a gente viveu
climate
bastante também na época
crisis,
da
and we
Covid,
have
pode também atrapalhar não só a ação
the lack of
climática, mas também
information. This can
ações na
also
área da saúde
impact
que têm
climate
impacto
actions
na questão
and
climática. Isso
also
também está
the
sendo
health
pensado.
aspect.
É grande desafio.
This is a huge challenge because, unfortunately, what we lived in the government that was the previous government. I am in the government or the administration of the Lula administration because I believe in this government. What we lived in the past, it left marks. We have a survey called Busca Ativa. What is it good for? It helps to qualify this under-notified data with respect to the death. So we are working with SUS and other companies that have been hired. We had to lead with the situation. I had to help to solve the solution. Two field researchers that were trying to identify death that were not in the information system, because this is the function of this research, is to correct the under-notification. In a situation in the city of Porto Velho, 100 kilometers from Porto Velho, in a district of dwellers that photographed the research saying that were people that were hijacking children. They then went to the police station, and from there they went to the airport. So we couldn't conclude the research over there because somebody from a regional condominium there, they were wearing the logo of the Ministry of Health. Everything that we use, the uniform, we did the local communication. We also communicated in the local radio. Dwellers of a specific rich condominium didn't want them to be there. They photographed the car, they photographed the researchers, called the police, and they were then sent to the police station to be protected. I had to call the secretary saying that they were researchers, but we are living in an era that shows the non-acknowledgement of science, and that so everything that involves the production of scientific production within public policy, they have to be reinforced by all of us that are here, because this is one point. And another, and what do you ask? Another question? Because this is how to face this lack of information and inaction. We need a lot of information, actually. I believe that we have to mobilize all the sectors, and we are in a new era of communication. We have a new layer of communication, interaction of the society, which are the digital means, but we have many ways of communicating. So we have to make use of all of them to show and to bring this. We don't only face this for research, for vaccines as well, that suffered a lot of attack as well. So we are battling to recover this coverage of vaccines in Brazil. Brazil has always had a robust vaccination system acknowledged worldwide. And here, now we are talking about the vapes. That is an area that I work. We're talking about alcohol and other risk factors that we have to bring. We have to collect a lot of information with different means, different actors. And you saw the power that Felca caused. So we cannot, we cannot be distant from this new way of communication, because we have to make good use of local leaders and also the digital leaders. Okay, perfect. Erica, you are in a region that is very characterized by the agribusiness, and also there is that about Infra-Amazonia, showing that about 80% or 75, 80% of the elected mayors in the Amazon region do not have a discourse about the environmental aspect. Obviously, it's got to do with the climate aspect, and also health would be a pathway to show the practical effect of the day-to-day of the population. This indeed happens. I'd like to hear a bit of that and how to make people that are in the territory, in the cities, they can depolarize, so to say, the climate aspect that people try to polarize. It's a quite complex question. Altamira, you talked about Brasil Novo, Medicilândia, for example. These areas or regions, these large municipalities in the Amazon that are protected but has been advancing in deforestation, these areas are indeed responsible for the deforestation and also for the production of CO2 in the world because of the cattle raising. So, Senador José Porfírio, which is Altamira municipality, is one that had the highest percentage of voting in Bolsonaro, the least percentage of COVID vaccination. So these things sort of go together. We see this relationship with the health, with policy, with climate aspect. And with COVID, this was very much evidenced. So I'm a bit of a pessimist with respect to depolarizing. I am a pessimist. We need, of course, to have the data, but I don't believe that denying these things comes from the lack of data. We have a huge amount of data, vaccine, and then sort of autism. So this does, the denial doesn't have anything to do with this. I think it's got to do with the political aspects, ideology, and how this then, how the information arrives to us in a fragmented way. And people, there are certain authors in psychoanalysis showing that the denial had to do much more with respect to the power and the dispute for truth as well, and rather than being scientific. So I believe that what we can do is to do our part to advance in this aspect, like for physical and mental health. For example, Medicilândia, this municipality close to Altamira, and the amount of cases of depression and suicidal attempts. There was a history with the use of agrotoxic glyphosate in the cocoa plantation. This will increase exponentially. It's important to have data so that we have the political courage within the public policies to act according to what the data show, because the policy shouldn't be denialism, so to say, but this is what Trump is doing, and to undo this, it's a huge work. We don't even know how to think how we're going to deal with this. Okay, let's follow. I believe things will work out. I'm worried about the anxiety because I know Renata must rush to the airport. So I would like to hear a little bit how you are preparing yourselves for this year, because now it's very much foreseeable that we'll have much more and frequent and intense situations. Well, I'm going to use my few minutes here to point out what I personally believe are valuable And also, it comes from a lot of reflection that you do within the Doctors Without Borders. We start with the principle here that the climate crisis is a health crisis, but this is not really given because it's very distant to people. Even people that do not have denialism bias, things are very distant because we ask people, and we ask people that support us in Brazil, said we support you because you save lives, but we support Greenpeace because they work with climate, different worlds. And it's still like this. This has a political impact of the negotiation of COP30. They does not include health. So we have to force this door. So health is going to be in this great battle. So after the 3 COPs, we had 1 day for health. We will be there, certainly. Doctors Without Borders will be there as strong as possible. But it is a battle to have one agenda for health within a copy. So we are very, very far from addressing this. So I believe that data and denialism is not because of a lack of data. If you do not have the data, things are going to become even worse. I celebrate the work that Vital does. I think it's absolutely, completely relevant. It's a drop in the ocean because this is what we're living. These are times where people believe in something that are quite surreal. But to play this great game in this environment like the copy, we have to continue producing robust and quality data in partnership with government and not, in fact, did not deny things with international organization, because we have to put more fire. And I'll try to conclude in an optimist note, because I believe that this copy will be indigenous copy. This is the great thing that I believe is going to happen. I believe that this is what I believe that this copy will bring, with the power of the indigenous population. This is what I expect to see, and I hope the world can see this. Really. Thank you very much. Renata will sort of release you. Now we're going to close with Wanda as well. And let's see what Wanda is going to say. Wanda, I'd like to hear you. And I believe that you can comment on this, the expectation of the indigenous population for a copy, for example. This was a request of from the co-president of the indigenous population that was not here. How much this COP will be effective and not only figurative, I'm going to hear in this sense, and what can you recommend, knowing the territory both within the community but the urban territory. And I'm just closing and saying that what really concerned me a bit was the data of people that are worried that they could do more. But the climate crisis is not caused by the person that are in the territory. These are large companies, governments. So you cannot think, this increases the anxiety, thinking that I'm the person responsible, but it's not only me. So I'd like to hear you talking about the COP of the forest that will be in the state, in the city of Belém. So if you go to Belém and you're going to be in the central region of Nazaré, you're going to see trees. But if you go to the periphery, you will not see any trees. So we are in here and we have air conditioning, but a person in the periphery of Belém that cannot pay air conditioning, they cannot sleep well. Imagine not sleeping well 1 week, 1 month, 1 year, many years. So this impacts the lives of people. So we as journalists must bring this to the ground and showing that how this is going to do with health and all that comes with it. So I'm going to close this panel with you to listen to you about your expectation of the participation of the indigenous population, the participation of the COP effectively, and the future, positive future, so that we can leave here not as anxious as we arrived. Well, I'd like to bring a point with respect to the data that was shown, and we have the responsibility with this data of, so it should be that it must be seen and publicized. I think one of our greatest failures is that we think that this information, when we have only one language, it will reach everyone. But we invest very little in this communication, the communication of the truth. And what we invest today is in fake news. Fake news has more investment compared to the real and truthful information based on data. This is a huge problem for us because this information doesn't reach us. So what reaches in the WhatsApp of people is the misinformation. So we must have a strategy of investment so that this communication can reach the territories. Because what arrives through WhatsApp is the extreme right disinformation that Brazil produces, and they invest a lot in reaching this peripheral population, indigenous population, and population that lives in the riverbanks. So we have to do this because science is also in a bubble, because the data that are produced reach certain people, but we need a language so that this data can affect people. This is my first recommendation with respect to the data. With respect to the presence of the indigenous population, here in Brazil, we have the ministries of the indigenous population. This is an historical fact because it is a political authority that is inside this dialogue, and COP is the meeting of political authorities of the world, large corporations, large governments, and these authorities that sit at the table to negotiate. And this is the first time, actually last year, in the COP in Dubai, in the last three conferences, we have a political authority, indigenous political authority, sitting at the round table, trying to bring the perspective of the indigenous population. And in the Amazon, we have a COIAB, an organization that is a coordination of the Brazilian Amazon that represents these 9 states and represent the populations of these 9 states. And there is a motto that says that the answer at the COP is the indigenous population. We are sort of affecting the climate policy in our country. So this is the first time that in the government they create the NDCs in this conference, because this is going to do with how we want this climate policy to happen for the communities. This is very important. We have the expectation of having over 5,000 indigenous globally wise present. About 13,000 in Brazil will be present in the COP, and this is the most significant number of the presence of indigenous population in conferences. There were conferences where we did not have this representation. This is an important and historic factor. But when I look to the environmental policy
como que a
and
gente
how
cria
we
mecanismos
can
ou
create
políticas públicas para
mechanisms or
enfrentamento
public
às
policies to
mudanças
face
climáticas.
climate
Eu também
change.
não tenho
I
muito
also
otimismo,
I'm
porque
not
quando a
very
gente olha para o
optimistic because
Congresso
when you look to the
Nacional,
National
quando a gente olha
Congress,
para o
when you
Senado
look
do
to
nosso
the
país,
Senate of our
essa
country,
estrutura
this
política,
political
ela
structure,
está
it
na
is
contramão
and
de
the
pensar e construir políticas públicas para esse
counterway
enfrentamento.
to
E o
face these
enfrentamento à
public
crise
policies.
climática ela é
And
extremamente
facing
política,
public
porque é
policy is something political,
sistema
because it is
político
a
que tem que
political
pensar a
success to
estratégia de
think the
enfrentamento
strategy
como
of
política pública e não
facing
como
this
uma
as a
ação
public
pontual
policy and
diante de
not
uma
just a
tragédia que é o que a
specific
gente vê
action
hoje, né?
in face of a
Não
tragedy that
existe
we
uma
see
política de
today.
Estado,
There is
existe
no
uma política
state
de
policy,
governo.
there is a policy, the
Política de
government
governo, a cada
policy.
governo ela se
Each
acaba, como a
government,
gente viu no governo anterior.
in every new
O que está se
government,
construindo
things
nesse
then
governo
change. So what is being
precisa
built in
ser
this
uma
government
política de
must be
Estado,
a
para que quem
state
venha
policy.
posterior
For those who
dê
come
sequência
after that, give
nas
sequence
políticas que estão
to the
sendo
policies that
construídas.
are being
Mas
built.
você olha para o
But
Congresso,
when you
você
look
olha
to
para
the
o Senado, o
Congress
que
and
está
the
se
Senate,
aprovando?
and what is being
Os
approved
senadores e
there?
os deputados
Senators
federais estão
and
pautando a anistia.
federal,
Então, uma PEC da blindagem.
federal,
Não tem
actually,
ninguém discutindo
federal
políticas
members
públicas
are
de
approving
enfrentamento às
amnesty.
mudanças
There
climáticas. E a
is
gente
no
não
public
vê
policy
essa
facing
representação
climate change.
política
We do not
nesse
see this
espaço de
political
discussões
representation in
climáticas.
the space
E não tem
of
ninguém se articulando para isso.
of
Quando você olha
public,
para a Amazônia, os 9 estados são
climate
governos
public discussion.
bolsonaristas que estão
What
lá.
we
São
see
da extrema
is
direita.
the extreme
Então,
right
a gente tem
wing
muita dificuldade de
Bolsonaro government
implementar as políticas
members. So
públicas
we
de
have
enfrentamento. Primeiro que
difficulties
não
of
está sendo construída quando a
implementing
gente
these
olha mais
public
para
policy
a
to
questão
face
dos
climate
estados,
changes.
dos municípios.
So they
Porque
don't
quem
look to the
ocupa
state
esses
and the
espaços de
municipality
poder
because
hoje
those who
é
take up
gente
these
do campo
spaces
da
of
extrema
polity
direita,
is the
que é
people
contrária a
from the
toda essa
extreme
agenda.
right wing,
Então,
which is
ano que vem é ano de
contrary to
eleição.
this agenda.
A gente
We will
precisa
have
pensar
election
quem que
year
vamos colocar
next
nesses
year.
espaços
We
de
must see
poder
who are we
para
going to
efetivar
put to
as
these
políticas ou
spaces
construir essas
of
políticas de
policy
enfrentamento.
politics
Porque
of policy,
nós, enquanto povos
because
indígenas,
we as indigenous
a gente
population,
tenta
we try
resolver
to solve
essas ausências de políticas
these
públicas
lack
há
of
milhares
public
de anos em nossos
policies
territórios,
for a
né?
number of years,
A gente
millions
tem
of
nossas
years in our
tecnologias
territories.
sociais e
We have our
ancestrais
social and
que dão
ancestral
conta dessa
technologies
ausência,
that
mas
deal with this
quando a
lack.
gente olha para os
But
nossos
when you look to
territórios,
our
com a
territories,
violência que
with the
está,
violence
com
that
a
we
não
see,
demarcação
with the
dos nossos
non-demarcation
territórios,
of our
inclusive
territories,
processo
is
de revisão de
also the
territórios demarcados
process
por conta
of
de que pessoas
of
que
territories
estão
that were
ocupando esse espaço de
demarcated
poder
because people
estão
are
criando
taking
vários
up spaces
mecanismos para
of power. They are
enfraquecer dos
creating
instrumentos
several mechanisms to
importantíssimo de enfrentamento à crise
weaken
climática, que inclusive a própria
the
ciência ocidental
mechanisms
reconhece
of
os
this.
territórios
So the
indígenas
indigenous
como esse
territories
mecanismo importante,
is
porque
an
é lá que
important
tem 80%
mechanism
da
because this is where we
biodiversidade,
have
estão as nascentes
80%
das
of the
águas. Então, a luta de
biodiversities.
nossos povos
So
na
the
conferência,
battle of
dentro
our
das
people in the
NDCs,
conference
é
within
fazer
the
com que
NDCs
se
is
reconheça,
to
né, o Estado
acknowledge the
brasileiro, o
Brazilian
governo
state,
brasileiro
the Brazilian
reconheça a
that the
demarcação dos
Brazilian
territórios
state can
indígenas e
acknowledge
quilombolas como um
the
mecanismo
markings
efetivo
of
de
the
enfrentamento à
territories
crise
of the
climática.
quilombolas and
Porque, caso
indigenous
contrário
population,
disso, os
and
nossos territórios
otherwise
estão
our territories
ameaçados
are
para
threatened
exploração de
for the
petróleo,
exploration of
exploração de minério,
oil,
exploração de ouro, potássio, tudo que é mineral, né?
every sort of
Então,
mineral, oil,
isso é uma
and
grande
also
preocupação para a gente vai
gold.
estar lá
This is a great concern
fazendo
for
muito
us.
barulho, com
We will be
certeza,
there in the
porque
COP
a gente
making a
ainda
lot of
tem
noise
desafio
because
muito
we have the
grande
huge
político
challenge, the
pra
political
garantia
challenge
da
to
manutenção da
assure the
vida.
maintenance of
Porque quando a
life.
gente olha para a
Because
luta
when you
indígena,
look to the
a
indigenous
luta por
battle
demarcação de nossos
for the
territórios,
demarcation
ela não
of the
perpassa
land,
pela só manutenção da vida dos povos
it doesn't
indígenas.
only have to do
É
with the
serviço que a
maintenance
gente
of
presta
the
há milhares
life of
de
indigenous
anos para a
population.
conservação da
It
vida
is
na
a
Terra.
service that we've been
Reconhecer isso é um
maintaining
ato
for
político
millions
de
of
cada
years
de nós
for
e não só dos
the
povos
conservation
indígenas.
of
Obrigada.
the land. It's not only our battle, but it is
Então,
actually
obrigado
of everyone.
demais,
Thank you very much.
Kivanda,
Letícia,
A gente
Lika.
encerra aqui o
We
painel.
close the panel
Obrigadão.
here.
E
Thank you very
40
much.
mais um pouquinho, a gente
And
vai ter agora
we
a
will
prévia
soon
do documentário
have
da
the
Helena.
documentary from Helena
Pedro, quase.
and Pedro, sorry.
Pedro vai dar a ficha técnica. Então, obrigado.
So,
Boa
thank
noite.
you very much and good evening. Thank you.
Gente, muito obrigado.
Well, thank you very much for the panelists and also Danielle for the mediation. And these data that were presented and discussed, they show how the people of the population of Amazônia Legal live the climate change. Today, they affect the territories directly, the way of lives, and the health of people. So this impact is manifested in specific areas, in different areas in Brazil, according to environmental, social, and cultural aspects. But they have to do with threat and adaptation that the literature calls climate anxiety. And to illustrate how the climate crisis goes through different realities, we invite you to watch the exclusive documentary Correnteza that happened in Rio Grande do Sul. So I invite to the stage Ana Petra. Thank you for the invitation. It is an honor to be here. I am a doctor, but I've been working with audiovisual already for over 10 years. I created a TV series called Unidade Básica. That is a series that tried to discuss the day-to-day. It's a fiction series that shows the day-to-day of the UBS and how this influences health and disease. We are in our fourth series, and it is one of the most important things to say is that I learned a lot with these debates, and I believe that one of the things that we talked about today was about the communication. And also, I think audiovisual is a very important instrument, and I believe in the power that we have to bring our ideas, show our ideas, and this survey that was presented has to be transformed into public policy and many other things that we discussed. But I also believe that we must think about innovative strategies, how to communicate. So the series is an example of this. The series is used in universities, in schools, health teams. Each episode covers one topic and discusses one topic. And during the pandemic, I directed a documentary that was about women in the front line in the SUS called Quanto Falta One, When You're Out of Breath, because after 5 years, we continue to present this film, and it has become an instrument of memory so that we don't forget that we lived. We were in the first year when we did not have the vaccines. We were governed by denialism government. And this shows that those who were in the front line fighting for the lives of people that were especially women, I think it's an important instrument. So all of this to say that today it is with great emotion that I'm going to show you. This is just a part of the documentary. It has not been launched yet. We hope to do this next year in the circuit of festivals, but may it be in an embryo of what we can do, start doing. We heard about Amazônia Legal, a place that is it's not only an acute situation. We went to the Rio Grande do Sul when the largest climate disaster. We arrived 1 month after the disaster, when in a moment where the waters had subsided, and we followed the work of the Força Nacional do SUS, which were voluntaries that came from the whole of Brazil to help the suffering of those people here. You can see there is a huge mental suffering in this situation, but there is a chronic situation that was discussed here in Amazônia Legal that also deserves to be looked at. So this is an invitation so that we can think together new strategies, and with this film may we make many other in the audiovisual aspect. And I'm here available if you want to talk to me or ask any questions after this. Thank you. I think the reaction that Luciana had at the end was a wow, actually. It's difficult to react in a different way, like many of us here that work or work within inside SUS, for example, SUS. It's something that's quite amazing. Congratulations. Thank you very much. And I'd like to, I'm still impacted. I'd like to thank immensely the presence of all of you here in this launching. And I'd like to thank the organizations that were here, that are here with us, and that do this event. This survey is talks in behalf of Humane and our partners of DeVivi. They follow with a commitment to promote innovation and evidence, more efficient and equitable public policies, and we know that it is important to quantify and to disseminate this so that things don't happen in this way, so that we can advance in the policies to protect people more. So I'd like to thank everybody here, involved here, the partners that were here, those that took some time to discuss this so important topic, important discussion in Brazil. And I think we have a lot of work to do still with the civil society, with our government partners, academy, with the entertainment sector, among other sectors. And it's going to be a long pathway. So these problems that we're facing will not end in the short term. Thank you very much. Enjoy your night. Have a great night. And a more logistic information, I'd like to ask for those who use the interpretation phones, you could deliver it in the entrance, in the foyer. And I hope to see you soon in other editions of More Data, More Help for the Brazilian population. Good evening.